Hi, everybody. Welcome to Nursing Home Echo. Glad you could join us. Welcome. We'll give people a few minutes to see if there's a few more of us joining. We typically have more people joining, but we appreciate you, Chelsea and Maria, for joining. Hopefully we'll get a few more of our colleagues on. But there's a lot to cover, so I'm gonna go ahead and get started with the intro. In any case, so John, if we could put the slides up, that would be great. Okay, welcome to our Echo. Next slide. Thank you to our partners and our collaborators for putting everything together. Next slide. And we just want to remind everybody that all case presentations, if we're sharing, need to be de-identified and HIPAA compliant, and that we want to create a safe learning environment for asking questions and comments and making comments. These case consultations don't establish provider relationships, and so these are basically a purely educational purpose. Next slide. Our objectives for this series is to think about well-being during the pandemic and recovery, practice age-friendly health system strategies, and think about some QI strategies to improve our care in our nursing facilities, and just increase our knowledge and regulatory guidance for quality measures. Next slide. This is how you get CME credits after the conclusion of our session. There will be a link in the chat box where you can complete an evaluation and you can get your CME credits. Next slide. And I just want to note that beginning in January of 2023, unfortunately, the Hawaii Consortium for CME, they've been providing CME all these years, are closing. And so in order to view and print a copy of your very own CMEs, you have to go online to access them yourself and print them up yourself. You find the instructions in the resource tab of the Echo website. So, I just want to let you know that, and that there is a link there as well. Next slide. Oh, did somebody have a question? I heard a comment somewhere. Okay, this is the third in a series on mobility. We're in September, and we're going to be talking about maximizing functional recovery, and we have guest speakers from OT and speech therapy. Next slide. Here's our hub. We have myself, Dr. Wen. We have Dr. Rita Fernandez online here as well. She'll be taking up the Q&A. Gail Rodriguez, our DON, and Dana Mitchell from Mountain Pacific, and Laurie Henning from HAH. Thank you for joining us. And of course, we're going to introduce our main guest speakers with Kristen Mcmanus from PT Works. Wave hi, and we have Janice Kang, who's a speech and language pathologist at PT Works as well. Thank you so much. Next slide. Okay, so I'm going to have Gail go ahead and get us started. Oh, you're muted.
Okay, can you hear me now?
Yep.
Yeah, okay, great. So my first slide was spirituality. Is it help for our physical health? Most of the publications that I've read, they were reviewing research articles, and many of them tried to define spirituality, but it's so broad of a term that the definition pretty much included many cultures, many religious sects, and educational levels. And that definition was extended over many concepts. So then they would discuss dimensions. And some of the dimensions of trying to explain spirituality talked about connection and relation. That was about 50% of the peer-reviewed articles that came up with that terms, that dimension. And so as I'm speaking of all these percentages, it's just in dimensions of how many research articles included those dimensions. And meaning and purpose, there was 52% of the articles, divine God, higher power, 40%, transcendence, immaterial, 39%, and others. Community relationship, that was 38%. Beliefs was 30%, and self-connection, nature connection, 25%, and values, 23%. Next slide, please. Yes. Okay, so individual and personal dimension, 26%, experience, 20%, practice and behaviors, 19%, peace and well-being, 15%, human aspect, 20%, the power, force, or inner energy of spirituality, 14%, sacred, 3%, which I thought was kind of low, but these are research articles, so I could understand that. Personal growth, 10%, and immanence, 5%. Next slide, please. And support, sustained element. I didn't get the percentage, I couldn't find it, but I'm pretty sure it was very low because it's in the low percentage rate. So I'm pretty sure it was about 5%. Dynamic process, 5%. Necessity was 4%. Spiritual beings, 3%. Art and connection, 2%. And life after death, 2%. So pretty much in the article with Di Brito, Damiano, reviewed 493 publications, and that's just to conceptualize the definition of spirituality. So it's very confusing, and they just, it was so much that they used, it was kind of hard to come up with a real definition of what spirituality is. But the most cited one says that spirituality is the personal quest for understanding, answers to ultimate questions about life, about meaning, and about the relationship to the sacred or transcendent, which may or may not lead to or arise from the development of religious rituals and the formation of community. And in the past, a lot of the hospitals were derived from religious roots, and they pretty much ran hospitals and cared to patients. So it pretty much, some of the hospitals were religiously involved in caring for patients. So it's not only the spirituality dimension of health for spirituality it's also in our workplace. And I felt that that dimension of spirituality and well-being was also missing, just like the rest of the research articles. I felt when I'm reading it, saying that the spiritual well-being is missing from the definition, and with whose definition of health, it is also missing the spiritual portion, but it talks about social well-being. So to conclude, the participants had beliefs that spiritual health, spirituality had dimensions such as such as religious and individualistic and material world oriented, and the components of how humans connect with God, others and themselves and nature, but identify that spiritual health and spirituality were connected. So the bottom line is that having spiritual health and spirituality contributes to or improves physical well-being and our quality of life. And I believe the next slide, please, is just my references, which I felt were pretty good to explaining spirituality and how it's not clearly defined, but they tried to conceptualize it. And that's what I wanted to bring for well-being today. And I'm turning it over to the next speaker.
Thank you.
Um,
All right, let's have Laurie from Healthcare Association of Hawaii share her slide.
Okay. Hi, everybody. Take just a minute to share my screen here. Okay, so I'm sure you're all aware that the bivalent COVID-19 booster has been approved and they are available here in Hawaii. We know that DOH has currently ordered the maximum allotment available at this time. So the CDC recommends that eligible individuals should wait at least 2 months after receiving their primary series, or if they've just received that prior monovalent booster, they need to wait 2 months before receiving the bivalent booster. And if you've had COVID recently, the recommendation is that you wait for 3 months. And just as a note, the previous monovalent booster is no longer approved for use as a booster. So all providers now need to be using one of the new bivalent vaccines. So DOH is working through Dr. Curtis Toma to offer the booster to our type 1 arches. And we know that PharmaCare is actively partnering with the long-term care facilities to offer the booster to residents and also to staff. So on September 8th, I just wanted to point this out, the CDC hosted a call on influenza guidance recommendations for 2022 and 2023, and guidance on co-administration with COVID-19 vaccines. And during this call, they stressed the importance of getting a flu vaccine this year and shared that providers should offer all vaccines for which a person is eligible at the same visit, providing that there are no specific contraindications. They did state that getting both vaccines is important for the prevention of severe disease, hospitalization, and death. So I just wanted to do a quick check with those who are in attendance to see, have you scheduled a COVID-19 booster clinic with your pharmacy, and have you chosen to offer the flu vaccine at the same time? And Dr. Wen, I can't see the chat room at the moment, so if you would just say if anybody responds, or if you want to unmute and just say what your facility is doing, we just want to check in on that.
Nothing in the chat yet.
Okay. All right. Well,
Feel
in the
free to
interest of
type
time,
it in anytime.
yep, in
Okay.
the interest of time, yeah, go ahead and type in your response and we'll keep moving forward. So NHSN has some updates that are taking place this month, and that includes reducing the reporting burden by permanently removing the monthly reporting plan. So with the latest updates, this is going to permanently allow for it to be populated by NHSN. And effective yesterday, they simplified the language for the primary series vaccination status section of the resident impact and facility capacity pathway. And that now includes the Novavax vaccine. And then in addition, NHSN will replace the influenza vaccination monthly reporting plan with language that supports auto-population of data by NHSN again, with the following agreements in place: that the data reported has to be consistent with the definitions outlined in the NHSN surveillance protocols, and then that data will be sent to CMS to fulfill the quality reporting requirements when it's applicable. And then we talked about this last month, but I just wanted to put it out there again as a resource for any of our assisted living providers. So the CDC's Operation Expanded Testing Program, which previously targeted schools, shelters, and correctional facilities, has expanded to include free COVID-19 PCR testing for our assisted living communities. It's available through December 31st of this year, and ALFs can receive up to a 4-week supply at a time. So there's no cap on the number of tests that can be used in this program. And I just wanted to, again, supply that link that, for more information and to enroll, go to the link on this slide. Let's end this together.com. Okay, moving on. For this slide, I think this is the least amount of red that I've had on this slide in over 3 months. So this shows Hawaii's community transmission rates as designated by the CDC. And nursing facilities, as you know, have to test staff who are not up to date with COVID-19 vaccinations based on the level of community transmission. So I just wanted to take a couple minutes again to, talk about that terminology of up to date. So on September 8th, the CDC updated their website to state their recommendation that everybody stay up to date with the COVID-19 vaccinations. And they defined a person is up to date when they have completed the primary series and received the most recent booster dose recommended for their age group. And then in the second paragraph on this slide, there's a link to a CMS QSO memo to state survey agencies. It was last updated last March, and in it, they defined up to date as a person having received all recommended COVID-19 vaccines, including any booster doses when eligible. So then looking below at our table, you're going to see that a couple of our counties fall into the yellow zone or the moderate level for percent of positive tests. But because the rate is determined at whichever is the more stringent level of precaution, and they both show as being substantial in the new cases per 100,000 category, then they're rated in the substantial category as far as transmission rate, which continues to be a twice-a-week testing cadence. And then looking at some of our local data, this is from the Hawaii State Department of Health, from their COVID-19 dashboard. The last update was on September 7th, and it shows a decline in our cases statewide. So every county is trending downward related to the 7-day average number of cases. And then this is hospitalization data from Laulima Data Alliance, and it shows COVID census statewide data over a 7-day period. So again, this data set is from September 6th through the 12th. And you can see that the daily stats on this page, as well as the 7-day rolling average that's listed there at the bottom. So since we met last, the average new COVID admissions actually went down from 24 reported during our last session, and now we're at 16. And then we also have fewer COVID patients in ICU compared to last time. Our average last time was 8, we're down to 5 now. And again, the average in-house patients hospitalized was at 136 last month, and now we're at 90 statewide. So these next 3 slides show those trends for the state of Hawaii over the duration of the pandemic. All of them support that data table that you just saw. It reflects the fact that we are trending down. So this slide shows the total confirmed COVID patients in our hospitals per day. And then this one reflects the total COVID patients in ICU beds per day. And again, you just kind of see that we're on that downward slope. And finally, this slide shows the rate of confirmed infections by state for the week of September 1st through, oh no, I'm sorry, I'm not there yet. This one shows the COVID admissions per day in our state. So again, you can see over the last 2 weeks, just, continually trending down on this one. This is the rate of confirmed infections by state per 100,000 individuals. And again, the dates on this slide, September 1st through September 7th. So you can see here, Hawaii is on the lower end of the scale when we look at where we stand nationally. And then for the total confirmed infections by state per 100,000, this reflects the entirety of the pandemic. So they define that as March 7th, 2020 through September 7th, 2022. Hawaii has the second lowest infection rate in the nation, and Maryland holds the position of having the least number of confirmed infections. And then this slide shows where Hawaii ranked for, again, that week of September 1 through 7, and that's related to COVID-19 death rate per 100,000 individuals. So as you can see here, we're mid-range for that week. And then for the entire duration of the pandemic, Hawaii continues to have had the second lowest death rate in the nation. We're following right after Vermont, who has the lowest in the nation. So just wanted to share where we were at as far as COVID tracking. And Dr. Wen, I'm going to hand it back to you.
All right, thank you. All right, we'll get the slides back up, and this time we're gonna, open it up to OT and speech. So we're gonna talk about maximizing functional recovery. So go ahead, you can take it away. We'll start with the next slide.
Aloha, my name's Janice Kang. I'm a speech therapist. I also wanted to explain about the terminology. Our titles professionally is called a speech language pathologist, but a speech therapist is synonymous. It's the same. The reason they changed it was there's a spectrum of services that we provide in evaluation and treatment. With speech therapy, it was indicating more of just treatment services. So a speech language pathologist provides the evaluation and treatment services for swallowing and communication disorders. So pathology being this definition of disordered things, speech language pathology, we evaluate and treat swallowing and communication disorders. Next slide. Thank you. A swallow evaluation, in terms of swallowing, it's a new field in the field of speech pathology. And a swallow evaluation by a speech language pathologist with the initials SLP, is the speech language pathologist, is helpful to determine whether modifying the food textures or liquid consistency may be beneficial for the safer swallowing, and to provide the instruction in swallow strengthening exercises, oral motor and vocal strengthening exercises to increase the individual's safety of swallowing and to reduce the risk of aspiration. Next, please. These are the pictures of the different phases of the swallowing. The first one being the oral phase. As the food travels back, you first put it in the mouth and it travels back to the throat area. The tongue pushes it back to the throat area and triggers the swallow. And in the second picture, that is called the pharyngeal phase. The throat is the pharynx. So as the swallow is triggered, there are certain things happening where the soft palate blocks off the nasal cavity to prevent the food from coming out of the nasal passage, and the tongue blocks the oral cavity from keeping the food from coming out of the mouth. The epiglottis is a flap that blocks the larynx so that it doesn't enter the airway. And the UES stands for the upper esophageal sphincter, which opens to allow the food to travel to the esophagus, which is the last phase, or the esophageal phase. Number 3 is the esophagus, how the food travels down to the esophagus. This process it's very quick. It's a second that a normal swallow takes. Next, please. Setting goals for the recovery of swallowing to ensure the safe swallowing of the safest and least restrictive diet and liquid textures to reduce the risk of aspiration. Also utilizing safe swallowing strategies and performing swallowing strengthening exercises with improving their safe swallowing abilities. Next, please. Aspiration precautions. These are helpful reminders to encourage the safety of swallowing, sitting upright at 90 degrees while eating or drinking, eat and drink slowly, small bites and sips, alternate food and liquids, using multiple swallows. Instead of just one swallow, it might take 2 or 3 swallows to get the food down to travel safely. Good oral care helps to reduce the bacteria so that it does not build up, and that is very important for keeping the oral cavity clear. And after the meal or snack, to be sitting upright for at least 30 minutes to allow the food to digest and to flow safely. The last one is to elevate the head at least 30 to 40 degrees when laying down. When sleeping, it's important not to lay flat because your airway is wide open. So a helpful thing is an extra pillow or raising the bed up a little bit to 30 to 40 degrees is an aspiration precaution. Next, please. Now, it's important to realize that a strong voice equals a strong swallow. The vocal cords and our voice is very tied into the safe swallowing abilities. So vocal strengthening exercises that helps to strengthen the throat muscles and to help protect the airway. So breathe deep and then to speak. That helps to our vocal cords to vibrate in a healthy manner and encourages airway protection, as well as helps with the projection of a louder and clearer voice quality. So let's try that together. Let's take a deep breath and then to say ha, ha, ha on the exhale. So let's try that. Take a deep breath. Ha, ha, ha. Good. And now let's take another deep breath and say the next one. Ho, ho, ho. Deep breath. Ho, ho, ho. Beautiful. Next one. Take a deep breath and say he, he. Let's say that together.
He.
Good. Excellent. So that deep breath before speaking helps to help the vocal cords to really vibrate in a healthy manner. Rather than shouting, it's important to speak with healthy dynamics, vocal dynamics. Next, please. To be heard and understood is such an important thing to communicate effectively. So as we look at the communication side of speech pathology, it's important to realize how important it is to be heard and understood and to improve the quality of our voice and clarity of our speech. And so a speech pathologist can really help with instructing in communication strategies to increase that socialization with others. So with the speech language pathologist, there are very different areas, multifaceted areas that we treat: speech, voice, language, swallowing, and also cognition. And positivity is something that I've incorporated in my treatment with the speech and voice clients, to use positive statements like I can do it, I am strong, to build up the speech clarity as well as their strong vocal dynamics. Next, please. Oral motor exercises are helpful with both speech and swallowing. As we strengthen our oral muscles, this will help with both improving our ability to manage the food safely and swallow it, to also help with the overall speech clarity to better be understood. So let's try this together. Let's read this out loud and practice some of the oral techniques. So number one, let's read that together. Open your mouth wide and say, ah. Do that with me. Say, open your mouth wide and say, ah. Next one, to smile and spread your lips and say, ee. So you can see the movement of the lips. Can you round your lips and say, ooh? And open your mouth wide and say, a. And round your lips and say, oh. So these are just the basic vowels, but by doing it with wide mouth movements, it will exercise your mouth muscles as well as to help with the overall clarity. Next, please. So the important thing is with the vowels is that, let's say it together. A, E, U, A, O. And the next thing to consider is that the speaking at a slightly lower pitch helps to increase the vocal quality. So by saying oh, hello, all the O sounds in the words, that helps us to have a clearer vocal quality. So saying it together, say oh, hello, how low can I go? Very low, way to go. Ho, ho, ho. Aloha and mahalo. Next, please. So with the speech, it's important to really enhance the speech clarity. So some of the key pointers were breathe deep, use wide mouth movements, speak at a low pitch and a slow rate. So by moving your mouth with those exaggerated movements, it will help exercise your oral muscles as well as help with the overall clarity and automatically slow down your rate of speech. Thank you very much.
Thank you. All right, next we have Kristen Mcmanus joining us for OT.
Hi, good afternoon. My name is Kristen, and I am an occupational therapist. So today I'll be explaining what OT is, as well as how you all can kind of help support what we do, as well as help towards your residents' recovery goals. So the profession. Next slide, please. We ask what matters to you, not what's the matter with you. So we as OTs, we help people across the lifespan participate in the things they want and need to do through the therapeutic use of everyday activities. So we call those occupations, just everyday activities. And next slide. Like in that definition, things that people want or need to do. Probably most familiar with ADLs, things like dressing, toileting, brushing teeth. But like that definition says, we're those medical professionals that also help with things that your patient wants to do, a hobby, working, playing. So we're those people that kind of come in when after maybe an injury or with older age, we start having trouble doing those daily activities. So in the next slide, you'll see that how we go about doing that is through something called activity analysis. So this is how we as OTs make our goals. So we take, something that they need to do. In this case, I chose toileting. And we as therapists are trained to break that activity down into all the many steps it takes. So a lot of us, I think, take for granted how easy, our day-to-day activities might seem, right? We can do a quick toilet break in like 30 seconds, get back to shift, right? But for our older adults, it's pretty complex. Here on the bullet points, I have a lot of the different skills that are included, from standing balance to arm and grip strength to pull up and down your pants, to leg strength in order to sit and stand. Maybe it's the memory of the order of the steps, right? Does our resident remember pull the pants down before we sit, right? So many, many different skills. So we as therapists or OTs address all of these different fine motor skills, gross motor skills, cognitive skills, sensory systems in order to get that resident to a more independent state doing their daily activity. So if you see, a lot of times there's confusion. Wait a minute, I thought leg strength was physical therapy, right? If you see on the next slide, with OT, while we may address, leg strength, the focus is always on an occupation or the daily activities. So in our long-term goal, we may write, patient will increase lower body strength to sit to stand with supervision in order to toilet more independently. So we're all about that independence with the activities. So again, our treatments may look a little similar, but with OT, our focus is occupation, whereas PT, the focus is a bit more on mobility, right? Gait training, walking around. They also are focused more on overall wellness and physical development. So maybe treating a specific injury or pain. So while we both work together, OT-PT, with your residents, the 1 or 2 hours a week of therapy, it's not quite enough always to make a difference in a resident, right? We need a lot of practice. And so on the next slide, I talk about some key ways that you as nursing, CNAs, administrators can help us in therapy as well as help your residents. So first of all, encourage independence. This is a key point. So think about it. Performing your daily activities are like mini workouts throughout the day. So you may have a resident who gets really winded after a shower or maybe after getting dressed. It's because it's hard and it's a workout. So having the patient engage in their daily routines and having them do an extra 1 to 2 steps themselves during it is a really great way to give them a workout, keep up their strength, and also give them a sense of responsibility and hope, right? I find that's especially true with toileting or dressing. If they feel a little more in charge of doing some of these things on their own, it's a bit of a motivational boost for them. So that's a great way that you can help your residents. Another one I'd recommend is encouraging bigger movements. So a lot of our residents are always kind of sitting in those wheelchairs, kind of arms in their lap. And I start as an OT to see tightness in the shoulders or in the hips. So you want to be encouraging bigger movements. Get the residents' arms and legs moving. Maybe it's, when you're helping them get dressed in the morning, hold that shirt a little higher so that they have to reach that arm through the sleeve, a bigger stretch to the muscles and more strength to the muscles. Change positions frequently. This is kind of for everyone. Check to make sure that, your resident isn't always maybe in the same chair all day. Encourage moving, even just getting up and moving to a different chair gets the body moving. Next, engage in leisure and hobbies. Again, this is one for nursing administrators. I really like to stress the importance of getting residents involved, in their day-to-day, build strength, coordination, because, not everyone likes that exercise. I can tell you, not everyone likes therapy all the time. So if we can find an activity that a resident enjoys doing, even if at tabletop, what a great way to give a resident a little bit of a workout, getting the hands moving, and it gets them out of their room. Maybe it gets them socializing with more residents, gets them sitting up instead of laying in the bed. So that's one sometimes often overlooked, and we want to be sure it's appropriate for that resident, even if, we've got maybe visual impairments or difficulty holding things. An OT or even just some simple tips and tricks can modify the activity so that everyone has something in their day-to-day. The last one, refer to therapy. So we therapists usually come in after an injury or a fall, which is great, but you as nurses and those CNAs, you're the experts when working with the residents day to day. When you're providing more help than usual, that's a telltale sign that that resident's starting to maybe show some decline in strength, balance. That's your sign to refer to therapy, because if we as therapists can step in and boost up the strength and balance, we can then help prevent falls and prevent injuries to your resident or even to you as nurses or CNAs. So get us in there so that we can help prevent things from happening. So on the next slide, I kind of just wanted to quickly show some maybe fun and simple ways to both get the hands working and the arms moving. With most occupations, daily activities, most of them use the hands or the arms. So that's, a big key, set of body parts to think about. So things like sorting colored pieces of paper, simple, gardening, or wiping the table after they eat their lunch, or throwing up to a higher basketball hoop, brushing hair. Brushing hair is such a simple way to get your resident to use their arms while doing something that they're going to do every day anyway. Of course, getting them standing doing activities is great, whole body, but depending on the resident, these are some simple ways to give them a little exercise. Then the next slide, I just wanted to talk about a few key tips that I almost always recommend in many cases. So avoid giving the resident too much help. Again, some may need help, but I find that with things like feeding, dressing, and bathing, those occupations, sometimes the resident can do more if we give them a little more time, or an adaptive tool, or maybe a simpler prompt. I often come in and say, oh, you know what? They're actually pretty independent with that. So kind of check your resident out for that. That being said, seek out adaptive equipment. Amazon or other retailers have so many great tools out there. Adaptive utensils like wide grip forks or spoons. If you have a resident who is always dropping that spoon, maybe we need an adaptive utensil. Or if you're showering that resident head to toe, but they've got some nice arm movements, maybe they just need a long handled shower brush, and then they can kind of sit and do all of it, saving you, the nurses or CNAs, maybe a little bit of time. Scoot forward in the chair, the toilet, before you stand up. It'll make it a lot easier. Put up reminder signs or pictures in your residence room. I can't tell you how many times I can get a resident a lot more independent by just putting a picture of what they need to be doing. A lot of times with our residents with dementia, the verbal prompt kind of goes in one ear and out the other. So a simple picture can really help. I mean, a lot of us are visual learners too. So the next one, give resident just a little time to think. The processing time in older age, a little bit longer. So consider that. And then all in all, just know that the more independent the resident is, the less you have to assist. So saves you as CNAs and nurses a little bit of effort, maybe a little time. And for administrators, right, the more independent your residents are, the more likely they can stay at your facilities. So all in all, it's really important to keep the residents as independent as possible. But then, as the next slide says, if you're in doubt, recommend an OT to come in. We are trained in this and can help your residents no matter what level or age. See if we can get them a little more independent. So thank you. So not sure if right now is the Q&A section for us. You guys let us know.
Yeah, Rita Bell, are you there? Anybody have questions? You can put it in the chat box. I have a question. What about does OT help recommend things like motorized wheelchairs and stuff, or is that more PT?
Yeah, it's a good question. So sometimes it can go hand in hand with PT. PT is typically the experts in mobility, but sometimes we'll collaborate with the cushions that they may need, or we'll collaborate on maybe the certain adaptive pieces that the wheelchair may need, right? Maybe we need armrests because they need that armrest for feeding in the wheelchair, things like that. So PT, OT collaborate together with like an adaptive specialist. There are a lot of specialists here, like National Mobility for one. So we'll collaborate with them.
Thank you, Kristen and Janice, for a wonderful presentation. Excellent job. And we so love all the exercises that you shared with us and how to set recovery goals for clients in nursing homes. So I thank you very much. And I'm looking at the chat. If there's any questions, feel free to put in the chat if you have questions for Kristen or Janice, or you could unmute yourself and please ask your questions. These ladies are a great resource and can share all their wonderful knowledge they have working with clients over the years.
Thank you very much for your kind words.
I have a feeling that we don't spend enough, we don't actually recommend OT or speech therapy as often as we should. I'm thinking right now.
I will say PT typically is the go-to.
Right.
And then like after the PT sometimes go in, they'll recommend, oh, wow, they need, speech or OT. But, speech and OT hand in hand with feeding, or yeah, like we said, everyday activities. So yeah, I'd encourage, all of you, maybe nurse managers or administrators, maybe even a simple description of like OT speech posted in maybe the charting area may help, because we're very, very available to help. And often we're a little less busy than the PTs. So sometimes we might be able to get in there a little faster. It just depends. So yeah, always here to help.
Yeah.
Janice, could you share what you can do for dementia clients and cognition, how you can assist with cognitive improvement, please?
Oh, yes. With the cognition, it's a very wide spectrum of different arenas, but just simple memory techniques in terms of writing things down, having pictures of important family, working on enhancing their memory, calendar, writing a notebook, starting a memory notebook with them to put important events, people, names, dates, places, or information that they want to recall. Also, if there are things in therapy too, we could write it down in terms of what steps are important in their safe mobility or activities. So to teach them techniques to help enhance their memory and orientation, problem solving, and different areas. So it's cognition's like a big blanket term for a lot of different higher level skills, but it could be the day-to-day basic orientation and memory also.
Thank you, Kristen. Janice, thank you, Janice. Kristen, I have a question for you on, in nursing homes, we have patients with tracheostomy. And how can we help them speak? Can you tell us a little more about the different valves and speaking devices that can help us in nursing homes, please?
Tracheostomies, I have just a little experience with that, but when I have worked with patients that have used the passing mirror valve, that's a one-way speaking valve that helps, with some residents, they have to be kind of assessed. It was working with like the respiratory therapist and the speech pathologist that really helps. But with the passing mirror, it helped both their voice and the ability to swallow. So it was kind of multifold in terms of helping some of the tracheostomy patients, but it is very important to see if they're a good candidate for that.
Okay, thank you so much for sharing that.
Oh,
Other
yes.
questions from our audience?
not, we'll move on, but please feel free to put the questions in the chat box and we'll interrupt to get to them. Anyway, I wanted to give you a reminder that we are continuing to evaluate everybody anonymously, of course. You know, as we provide ideas to help your residents and staff reduce falls and strengthen and increase function, Mountain Pacific will be monitoring your MDS data in aggregate. And so specifically, we'll be looking at section G, which is ADL performance, section GG with functional abilities, and, you know, section H, which is bladder and bowel incontinence, and things like that. So I just wanted to let you know that, yeah, let's keep working hard and, you know, on maximizing their functional status and preventing falls. And hopefully we'll see some improvements over time in the next several quarters. Next slide. And now I'm going to, let's welcome Dana from Mountain Pacific, and she's going to give you some tips about how to improve your quality, your QAPI efforts.
Thank you. Yeah, I thought today I would, instead of talking about survey and measures and things, I would give a quality tool that I just kind of picked one that I think is very helpful for wrapping your heads around how to engage your staff in quality. And so I chose rounding. Because I think I would think that we're probably not finding the time that we need to do roundings. So with everything that's gone on the last couple of years, so getting our heads back in that game just seemed like it fit for my psyche this month. So why round? So the purpose really is to hear firsthand, get out there, talk to the staff, hear firsthand what's going well and what isn't going so well, so that you can gather things to praise and things that perhaps you might work into your QAPI plan and your QAPI program. It also helps to build engagement and accountability. It's so important for people to see leaders out and about. And it signals that you've got a commitment to quality. So to build that engagement and, you know, emphasize everybody's responsibility for quality. Next slide. So who rounds? So I specifically spoke to leader rounding, and that'll be the broader sort of thing that I'll cover. But really, you could have anybody do rounding, from your CEO, your directors, managers, supervisors, charge nurses, infection preventionists do rounds. I mean, I think often we call them audits, but really they're rounding and finding areas to work on to improve. I think hopefully they're collecting information on what's challenging and what's creating barriers for folks. You can even have peers do rounding. For if you've got a culture that's really focusing on a culture of safety, culture of quality, you're wanting to build a level of trust within your culture. And I think you have to have a certain amount of that before you enlist peers for rounding. But they can go do sort of be the wingman for peer checks, for emphasizing perhaps projects that you're working on, things like that. People who are already your informal leaders can round, and they can be a morale booster and also garner more engagement. Next slide, please. So how are you going to round? Well, first you got to decide who's going to do it. You're going to decide when and how often. It's really hard to stick to it, so you've got to have some leader commitment to keep that ball rolling. Decide what you want to ask, what you want to find out. And then when you're out there, make sure that you're maintaining a positive tone. We want it to be a positive interaction for staff, even when they're expressing the things that are frustrating them. Assure staff that you'll follow up. And then most importantly, make sure that you are following up. Again, building that trust so that you're creating that culture where people feel comfortable speaking up. And then you can follow up on previous issues that were raised in your previous rounding. One of the tools that we used to use at the homes that I was at were safety stories. I don't know if folks use safety stories. We would start off meetings with a safety story, and typically they could be a story about a near miss or about an error that occurred, or about how we identified, say, potential safety issues, and created a story around it just to share that learning and get people used to talking about things as they come up. And so you can use those when you're out and about and saying, hey, you know, there was, if we want to pull in, say, a fall the other day, and here's what we learned about it. And have you seen anything perhaps that is like that situation that we could pay some attention to, for example. Next slide. So sample rounding questions, this would be more for leaders, I think, because these are the types of questions that perhaps a leader actually has the ability to respond to. Although the who would you like to praise, I think could be for anybody. As I said before, peers might have more defined questions because they may not have the ability or the authority to deal with kind of bigger issues. But as I said before, some can make really great coaches, safety coaches or quality culture coaches, especially as you're working on that culture of trust and safety. And again, IPs will have a very specific lens for their rounding, but you maybe would use, say, like our therapists. You might enlist them to round on something specific as well, as long as it's all positive and in the effort of supporting and all of us striving to be the best we can be and support the best we can. Next slide. So then after rounding, what do? You know, it's okay to go out and take notes while you're rounding. And so then go back and look and see if you're seeing any patterns in your issues or your themes. You want to prioritize your issues. So how urgent is this issue that's come up or threat? How easy is it going to be to resolve? And prioritize based on those sorts of things. You'll want to follow up. You can follow up individually with the folks that express their concerns to you, or, you know, it's, I can't remember what they say, but, you know, however many different ways that you have to communicate, do it, because that will hopefully reach everybody. So in writing, when you're backgrounding, if you've got reports that you do, if you do meetings, communicate in your follow-up. Praise in folks, acknowledge and praise them for engaging and for their efforts to do better. And then identify your process improvements or your training or coaching needs. And that was, next slide, super succinct. Just reminder about rounding. CMS does have a tool that you can find on their QAPI site. I think sometimes CMS's tool examples can be a bit much for folks, and I encourage you to strip it down so that it's something that's manageable for where you're at now, so that at least the efforts are being made and you're being out there, being seen, and folks feel like they're being heard. And that's it. Any questions or comments about that? Are folks using it successfully currently? I mean, I know it's been hard to get anything done right now the last 3 years, right? But
Okay, John, can you stop screen share? Okay. Great. Thank you, everybody. Thanks so much for the reminders to pay attention to our spiritual life. And also thank you for the reminders to round, right, and support our staff. Thank you for the reminders to make consults for speech therapy and occupational therapy and really think about what matters to our residents, not just, you know, exercise for exercise sake. Really important. Thank you, everybody, for all your continued efforts to give our residents the best quality of life possible. So, yeah. So, any last minute questions? You can get it under the wire. You got 1 more minute. To any of the presenters, it's fine. Oh, and don't forget that there is a link in the chat box to do an evaluation, and you can get your continuing education credits. So I'm going to go click on that. And everybody should do that too. All right, thanks everybody for joining us, and we'll do one more session on mobility and function and next month. We'll see you then.
Thank you.
Thank you.